Welcome to another interview by the Fibroids Project, bringing you information to make life better for women with fibroids. Today's guest is Dr. Ayman Al-Hendy, who is the Vice Chair of the Department of OBGYN and Scientific Director at Meharry Medical College in Nashville, Tennessee. He also serves as OBGYN at Nashville General Hospital and adjunct professor at Vanderbilt University Medical Center. Welcome, Dr. Al-Hendy. Our members are very excited to hear about the research that you've been doing. But before we begin to discuss that, I'd like to really ask you more about your responsibilities as the scientific director of the Center for Women's Health Research and your duties as a professor and vice chair of OBGYN at Meharry Medical College.
Sure. Well, basically, like many faculty and academic centers, our time is divided typically usually three, but in my case, and when you have a leadership position, 4 ways. Part of it, and the most important part, probably is the clinical service. I serve as a gynecologist at Nashville General Hospital. My main interest is actually uterine fibroids, and a lot of my practice focus on uterine fibroids. So of course I do the office, and then of course the surgery that's related to my patients that I see in the office. And of course part of that also is working with our residents. We have a vibrant residency program, about 12 residents training at the moment. So we work with them and we do some teaching and bedside teaching and so on. And then the third part is the research. And I have an active lab that's NIH funded and also funded by other agencies like the U.S. Department of Agriculture, etc., but mostly from the NIH to do work on uterine fibroids. And we actually have been very active in this field for many years. We have about 60 publications in this area. And our focus is on 2 aspects of uterine fibroids. One is to understand why this disease is very common in certain ethnic groups, particularly African American women. And the second part is to develop new methods of treatment. As you know, the main treatment option at the moment is mostly surgical, although there are some promising other non-surgical treatments, but there's really no medical treatment, something you can take by mouth or inject directly into the fibroid, something to target the fibroid and spare the rest of the uterus. So my research has focused on this area for many, many years, and it's very exciting. And then the last part, probably the least attractive part, is the administration, because I'm the vice chair of the OBGYN department and the director of the Center for Women's Health Research. So that's kind of how my time is distributed. The Center for Women's Health Research at Meharry, I just want to say, is very unique because it's probably the only or one of very few centers in the country that focus on diseases of women of color. It actually has started with the effort of Dr. Valerie Montgomery Rice, the ex-dean of the School of Medicine at Meharry. She's also an OBGYN, and she has been very big advocate of minority health, especially minority women, minority health. And she started this center to focus on diseases that are more common in women of color. Of course, one of them is uterine fibroids, which is your interest, but there are unfortunately, many other diseases also that are more common in African American women, like preterm labor and breast cancer, obesity, etc. Actually, the list, unfortunately, is pretty long. So she started the center to try to attract attention and to focus on those kind of group of diseases, and then she brought me in as the scientific director.
That's amazing. I'm excited to learn more about what you've been doing and to be able to spread this information to our members. And like I said, they were very, very excited about the research that you've been doing, and I'm happy to hear that this research in this center is specific to African American women and the different gynecological issues that we have. So I'm going to jump right in with some of the questions from some of our members. We had we put out a call, like I said, through Facebook, Twitter, our website, fibroidsproject.com, and we've gotten a phenomenal response from women. Bee and Joy were two women that responded through Facebook, and they wanted to know what regulates fibroid growth, and does it differ from cancer growth in any way, and if so, how?
Okay, that's very good questions, and I'm really kind of glad that your members are interested not just in the treatment, which is usually the questions that we get, but also understanding the fundamental etiology and the basis of fibroids. So, well, fibroid is not cancer, so that's very good news. It's a benign disease. It doesn't go anywhere else outside of the uterus. It doesn't metastasize, and that's the main difference between a benign tumor and a malignant tumor. That doesn't belittle the effect of fibroids, of course, in women's life, and your members probably know this very well. It does affect your quality of life and affect your health in major ways, but it's not cancer. So now there is a cancer equivalent to fibroid. The scientific name of fibroid is called leiomyoma. There is a cancer equivalent to that. It's called leiomyosarcoma. And luckily, this is very rare, and it's not a continuation of fibroid. For example, the few cases of leiomyosarcoma that we see, it doesn't start as a fibroid and then goes into the cancer counterpart. It actually starts straight as leiomyosarcoma. So I think we can take this out of the picture. Fibroid is a benign disease. It does not change into cancer with time or anything like that. Now, fibroid is slowly growing, and it's affected mostly by the women hormones, specifically the estrogen hormone. The ovaries in women in reproductive age from the age of menarche, the first period, let's say around 13 or 14, until menopause, when the ovaries stop producing hormones, the ovaries produce two main hormones, estrogen and progesterone. And actually both of them enhance the growth of fibroids. So any excess of estrogen or progesterone will make the fibroid grow faster. For example, in pregnancy, fibroids tend to grow faster because you have abundance of these estrogen and progesterone hormones, because at that time during pregnancy, they don't only come from the ovary but also come from the placenta. So that has been documented. Of course, if a woman takes steroid hormones externally, for example, certain birth control pills can actually make fibroid grow a little faster. Or food that has a lot of steroid hormones, like soy products, for example. I mean, soy products are great for postmenopausal women because at that time your ovaries stop producing hormones, and a little bit of hormones in the food actually might help your bone health and your menopausal symptoms. But in the reproductive age group, in the younger women group, too much of soy products, which has a lot of estrogen material, will actually make your fibroid grow faster.